Patient diagnosis: a clinical test presentation by Jennifer Norman for Organic Chemistry 2024. A female patient is seeking medical care. She is 25 years old. She stands at 5 feet and 2 inches tall, weighing 120 pounds, and her ethnicity is African American. The patient is complaining about being tired, an increase in urination, and swelling of her legs and feet. After taking her blood pressure, her results showed 185/95, which is high and could indicate that she is suffering from hypertension. With the information presented, my hypothesis of her diagnosis is diabetes. The first step in confirming the diagnosis is to perform clinical tests using patient samples of urine and blood. The first test performed was glucose testing. With the use of a glucose meter, a small sample of the patient's blood was placed on the designated test area on the test strip. It was then inserted into the meter. Once the system is done assessing the test strip, it will display the results. For this patient, the results showed 120 milligrams per deciliter. Next, the Benedict reagents test was conducted. A sample of the patient's urine was collected. The Benedict reagent was added. The liquid changes color as the copper reacts to the aldehyde group in glucose, oxidizing into carboxylic acid. In this patient's case, there was a change. The liquid turned green. The last glucose test conducted was a reagent strip. A sample of urine was applied to the strip to determine the patient's glucose levels by selectively reacting to the enzyme glucose oxidase. The test showed a blue-brown color measuring 500 milligrams per deciliter. Overall, these glucose tests show an abnormally elevated glucose level. This all provides evidence that there is a great likelihood that the patient is suffering from diabetes, supporting my hypothesis. When a person suffers from diabetes, their glucose levels build and can reach dangerous levels. The next clinical test completed was the CK enzyme absorbance over time. This test is important as when the levels are high, there is a reason to suspect muscle disease or insulin-dependent diabetes. Since the patient's results were in the normal range, these diseases would not be likely. Next, the patient's LD enzyme absorbance was tested. When a person's LD enzymes are high, it is likely that a person may have liver disease, anemia, heart attack, bone fractures, muscle trauma, cancer, or infections like encephalitis, meningitis, or HIV. The patient's results came back in the normal range, so these diseases are not likely. Another test completed was a protein test. For this test, 8 milliliters of urine are boiled in a test tube and examined for precipitate. If precipitate is observed, then acetic acid is added and the liquid is boiled again. In this patient's test, the results were abnormal. This is important because high levels of protein in urine can indicate kidney disease, diabetes, urinary tract infection, and more. For this particular patient, the results having abnormally high levels supports the diagnosis of diabetes. Continuing with the clinical tests, a reagent strip was used to test the patient's urine for pH and specific gravity, or SG. The results of the reagent strip was a SG of 1000, which is abnormally low, and a pH of 6.0, which is considered normal. Usually a pH for a diabetes patient would be more acidic in severe cases. It is first identifiable in the blood and eventually would affect the urine as ketones build. In this patient's case, it does not rule out diabetes, as it could be a less severe case that it has not reached the urine yet. A clinical test was conducted with reagent strips to assess the bilirubin and ketones in the patient's urine. The results were a ketone of 0.5, which is a trace that is normal/low. The bilirubin level was 17, which is small and is normal/low. If the levels of bilirubin were high, they could indicate kidney issues, and ketones being high could indicate increased glucose. In this case, since they are normal/low, it does not support or deny the diabetes diagnosis, as like the previous test, the ketones may not have increased enough to be detectable in the urine. The last clinical test completed was the Ehrlich's reagent test. For this, a small sample of urine was used. Results showed a normal/none indication. If his was abnormal, it could have indicated hemolytic anemia or liver disease. In conclusion, the hypothesis of diabetes has shown to be the most likely cause of the patient's symptoms. It is supported by the glucose test being elevated, the protein test being high, and the SG being low. Due to ketone levels being normal, it is reasonable to assume this is a case where it has not reached severe levels, which means that less invasive treatment options are possible. Treatment for the patient would include encouraging a healthy diet. This includes a focus on fruits, vegetables, lean protein, and whole grains. Additionally, they need to reduce their intake of saturated fats, refined carbohydrates, and consumption of sweets. Executing exercise can have a profound effect on the treatment of diabetes. Physical activity can lower the blood sugar levels by moving the glucose into cells to be used for energy. It is recommended to execute 150 minutes of moderate activity each week, and after sitting for 30 minutes to stand for a stance of time to get the blood flowing. After being diagnosed as a diabetic, it is important to monitor one's blood sugar levels. Lastly, treatment will include medication. There are a few different options that a doctor can offer depending on the patient's symptoms. The most common and well-known treatment is insulin. There are also drugs that can increase the pancreas to release more insulin, prevent the production and release of glucose from the liver, block the stomach or intestinal enzymes from breaking down carbohydrates, or prevent the kidneys from reabsorbing filtered sugar into the blood. Please find displayed the references utilized for the creation of this presentation.